Hello, it's Mohammad Razzaq. I am one of the nephrologists from Bangladesh. I am going to present my case for Guamcon. A 20 years female presented with generalized swelling, reduced urine volume and bubbling of urine and found to have nephrotic syndrome on routine labs. The overview of the case: she has no significant past history of any autoimmune disease. She was not any medication, not allergic to any medication, and she is unmarried, non-smoker and not taking any illicit medication. She was started on swelling of whole body for about 1 month, then swelling appeared in the face, legs and eventually all over the body without any urinary symptoms, without any uremic symptoms or any systemic rheumatological manifestation. Initial lab revealed nephrotic range proteinuria along with other parameters suggestive of nephrotic syndrome. She was started on prednisolone empirically on February 9. As she was not responding, renal biopsy was done on March 23. MCD came out and she was started on MMF along with prednisone, but she was not responding. That's why she was started on tacrolimus along with prednisolone, but even that she was not responding. Unfortunately, she has missed her several follow-up schedule during the course of her treatment. She has stated that she was continuing all her medication. As she was not responding to the treatment, we had to plan our next ideas. We had a plan for rebiopsy to rule out any alternative diagnosis, genetic analysis, rituximab therapy. I just wanted to go through a brief discussion on glomerular disease and also perspective of renal disease in the Southeast Asia as well as Bangladesh in next few slides. The burden of glomerular disease is increasing all over the country, all over the world as well as Southeast Asia as well as in Bangladesh. Chronic kidney disease is a major public health problem nowadays. Along with diabetes, hypertension, glomerulonephritis is increasing. In Southeast Asia, the burden of kidney disease is also increasing, and most of the countries of this arena have low to low middle income, except Maldives, which is in upper middle income country. Over 65% of population of this area lives in rural area. So over 65% as living in the rural area, they are also deprived from various facilities. All countries in this region have the problem to fight with kidney disease. Increasing number of training program, growing government support in renal replacement therapy is developing nowadays, but the facilities is still not satisfactory. Renal disease in this region represents interaction between the kidney and the environmental problem and also social and regional conflict. This picture demonstrated the countries in Southeast Asia. I will skip this slide as it is so busy. The annual cost is so high, most of the people cannot bear this cost for the treatment of kidney disease. On the other hand, in Bangladesh, the incidence of kidney disease is also increasing, but the facilities of treatment is not adequate yet. Moreover, the data is very limited in this country. For inpatient admission, every patient have to pay fees for investigation, expenses, food and treatment. There is also government support as well, but that is not adequate. Social welfare development is also not that much developed, but it is improving, but it still have to go a far away. The social deprivation is one of the factors for increasing burden of chronic disease like CKD. There is also lack of sanitization, quality of life, and there is also financial burden as well. Insurance is important for health support, but that is also not developed in this country. The demographics from 1916, the total number of population in Bangladesh is 16 million, but the social development index is only 0.51. You know, for diagnosing of glomerular disease, electron microscopy is very important, especially those who are involving the basement membrane and podocyte. But unfortunately, these facilities are also not available in Bangladesh. Many times we have to send sample in neighbor country. That also increasing the financial burden. So come back to our patient. As she was not responding to multiple immunosuppressive medication, we have suggested for genetic study, rituximab therapy, and that was not feasible given financial constraint. That's why we had an alternative therapy. We had to choose an alternative immunosuppressive protocol for her, and she was advised to come with follow-up. For that reason, we need to advance our kidney care program in Southeast Asia as well as in Bangladesh. Sister Center exchange program of our young nephrologists in training to spend the prestigious center abroad and gain valuable clinical and technological experience as well as contracts have proven valuable. Thank you for your patience.